I've wanted to be a doctor ever since I was 7, 8, 9 years old. Really? And I don't know that I can tell you why. It's just something that I always wanted. And I wanted to do it all the way through high school. Sure, I knew you'd make a living, but that wasn't in my thoughts in the top. I mean, that was down here someplace. I started in the first of the year because I got out of the service in December. And so when you enroll, I enrolled in pre-med, and then they have a counselor that helps you set up how you do your classes and how you get things. And I think it was a she. She says, well, she says, you should change your major. She says, you're never going to make medical school. You shouldn't, you should do something else. And I said, no, that's what I'm going to do. And we can do a lot of things, but one of the things you can't measure is motivation and what somebody's will is going to be. I guess that's the moral of the story, because the rest is history.
How many years did you practice?
40.
Yeah. And how many babies did you deliver?
Oh, close to 10,000. One of the things that influenced me to go into OB, I think, was Dr. McKelvey, who was my chief. He was a stern old guy, but he was a real teacher. And it was just somebody that you'd admire. And then he would give oral exams, and you'd go in his office and you'd sit down and he'd ask you some questions. And my partner was a kid by the name of Norbert O'Keefe. And so he said, what's your middle name? And he says, I don't have one. He says, until you get a middle name, get out. I mean, he was that kind of a guy, but he was also the kind of a guy that he would have world-class speakers come to the university, and then we would have dinner parties and at his house with our wife. And so when we got done with dinner, he got up and took all the men into the kitchen and handed them all a dishcloth, and the men did the dishes and cleaned up afterwards. That was a tradition that he started. So you get some of these guys from Princeton and Yale and Johns Hopkins, and they know what to do with dishcloth. But it was a good tradition. Those are the kind of things that he was great at. And he was a good example, good mentor. I remember my first breech delivery as a resident, though. Breech is where the bottom comes out first, and they're complicated. I mean, they can be. And I remember standing alongside, and the resident said, well, here, Milt, you do this. And so I reached down and took the stool and moved it away to stand there. Well, I contaminated everything, so I had to get up. So I couldn't even be in the delivery. So it's one of those things that's just sort of stupid, but it happens. You're just so concentrated on getting there and put the stool out of the way. I remember that. And that's what learning is about, is you remember your mistakes and you learn more from them than you do from your successes. We had good faculty, good clinicians. They were good people. They pushed you to a limit. They expected a lot. Had one fellow by the name of Irv Kaiser that was probably the smartest one of the whole group, but he was brutal to all of the young fellows. And at the time that I was in residency, probably half of our group had been in the service as physicians, but they had some OB experience. The other half of us weren't in the service, so we were sort of in a different level. And he took us, the guys that hadn't been in the service, and he was brutal to us about how you did. We'd call him up in the middle of the night and say, we have this problem, this is how we're going to deal with it. He'd say, okay, that's fine. And then we'd have a conference on Saturday, and you have to present the cases. and then he'd just chew your tail out, and just everything you did was exactly wrong. I mean, he would embarrass the hell out of you, but he did teach you to think, and he made you make decisions, and in the long run, he probably was good. It was just his style, and but for young guys that hadn't the experience, it was gut-wrenching. I mean, he was really tough on us. I wanted to quit more than once because of him. But in the long run, I think he taught you something. McKelvey was the same way. He says to the residents, either you teach or you're out. That means you're gone. You aren't out of the residency. You didn't stick around. That was one of his requirements, is that you ended up doing teaching or you didn't belong in his program. That was just part of his requirements. I'd heard from somebody, I think it was a drug salesman or something, that I was going to practice in Minneapolis and I just didn't want to spend my life in the car. So I ended up looking around, and towns that would be large enough to take an OB man, and somebody said that there was an opening here, and so I came down and talked to a guy by the name of Fred Stahman, and we sort of liked the size of the town and the hospital, so we came. And there were only, at that time, there were only two OBGYN boarded men in town, Fred Stahman and Bill Sersel. I think I spent 2.5 years with Fred. And then I opened an office on the Koenig building on Minnesota Avenue. We delivered our own babies. So at that time I was on call 24/7. I had a delivery every night between midnight and 6 in the morning for 6 weeks. And I'd get just tired, and so my wife would put me in the car, and we'd take the kids and drive down to Omaha, and I'd spend 2 days sleeping, and then we'd come home and we'd start over again. But our chief said, unless you can stay up 2 nights in a row and drink scotch the third night, he says, you don't belong in OB. One of the exciting things about medicine is you may walk into a room that I can teach you to deliver a baby and nothing will happen. And the next time you walk into the room, all hell is broke loose, and you've got to solve that and solve it quick. You can't sit down and call other people. You've got to do what needs to be done. And that's really what a doctor's for. And I really like that. Oh, I guess it's accepting reality. You can't win it all, but the thing that you learn is that you try and you tell the truth. And if you tell the truth, people know this. And a good example is I had a cesarean section that I was doing on a woman who had had a previous cesarean section. And her husband was in the room sitting at the head of the table. And she was right in the middle of a lawsuit of the original doctor that did her first cesarean section. And she'd had a classical section, so I made an incision on the skin, and when I cut through what we call the peritoneum, I cut the bowel in half. And so I dug it around and I showed her husband. I said, look, this is what happened. This is the complication that we got. And we freed it up and put it on the side. And I called Dr. Ensberg, a surgeon, to come in and fix it up. And we finished the case, and the baby was fine, and everything worked out fine. And the husband looked at me, and when we were done, he says, you know, doctor, if I wasn't in the room seeing what you did, I would have thought you were the biggest klutz in the world. But when you see what you're dealing with, he says, I don't know how it doesn't happen more often. So it's a matter of when people know what happened, and so when you screw up, you say you screwed up. And the lawyers don't like this, And I assume that there are cases where you've just got to learn to swallow. But I think that I think people like to be treated like people, and they don't want to think that you're not honest with them. And you apply that to any kind of medical situation. You can apply it to all kinds of things. So people know when it's not right, and you can't fool them. They're smart people.
Yeah.
And so once they know why something happened and understand as best as you can, that's not they're not going to agree with you all the time, but at least I always had the philosophy: if you tell them the truth, you don't have to remember next time you talk to them what you told them, because it's going to be the same story. I know that I've had patients that have gone out of the office just madder than hell at me over something, and Marilyn would say, "Do you know this?" And I would call the patient up or take care of it next time, and they really became some of my best patients, and yet they were madder than hell at times. So it's, I always used to go on the principle that 80% of your patients loved you, 10% disliked you, and 10% didn't know what to do, if they could go or where to go or how to do it. And there's just no way you can please 100% of the people, and you just do your best. Warren Jones was an internist, and he was involved in the medical school. I think he was in charge of all of the physical diagnosis. So he would recruit us all, that students would come up here to Sioux Valley, and so I got involved in doing the GYN teaching to them. And so there would be, I think, a quarter every year that they would come up, and they'd spend 5 or 6 weeks coming up every Saturday or one day a week. And because usually it was time off. It wasn't the time when we would see patients. And so you'd get a group of patients, or get a group of students, and then you'd try and get them patients and try and teach them what to do and why to do it. And it's sort of a program that just grew. None of us ever got paid. We just did it because that was part of what we should be doing and passing on. We used to tell the students, and they don't pay any attention to it anymore, is if you want to be a doctor, look like a doctor and act like one. As a patient, do you want to walk into a room and see a scruffy old guy with all kinds of beards and a dirty old sweater and floppy shoes? I mean, what kind of confidence does that give to people? And when I'm going to tell you I'm going to operate on you and do whatever procedure, you want to feel comfortable with that. And I think things like that make a difference. I think a lot is by example. I guess I felt I would rather be respected than liked, and that there were standards that you were going to maintain. And if you didn't have those standards, they wouldn't have those standards. We had an intern who went into orthopedic surgery and is up north. He used to go to Augie and was an All-American football player. And most of my deliveries were under local, so it's hard to tell a student how to do things when you got somebody sitting there watching you. You don't want them to feel that, well, I want you to do step 1, step 2 type of thing. And so I would have a pair of scissors, because I'd cut the sutures for them, but I'd point where I wanted him to, and if they were going to do something that wasn't right, I'd take the scissors and knock it away. And so Ron was down doing an episiotomy, and I was doing this with him, and all of a sudden he stood up and he threw the scissors on the table, and he says, "God damn you, can I please you?" and walked out of the room. I still remember, but there was, you were trying to show him where you wanted it, how you wanted it done. Oh, I think you're just trying to do better and improve things. What could I have done better? or if I had a problem, is how we could have prevented the problem or how we could have fixed it different than we are now. I guess it's a curiosity, and it's setting standards for yourself anyway. When I first started is when they first started the pap smear, and we would scrape cells off, and then they developed like a microscope that you could stain the cervix and look at the cervix for certain changes, so you pick up diagnosis of cancer of the cervix earlier. I started laparoscopy in South Dakota, and we were at one of our continental meetings, and one of the fellows presented this because it was just rather new. And so we decided, you know, that really is something that we ought to learn. The thing that started this was a procedure called an amniocentesis, where you put a needle through the abdomen into the amniotic sac, and you pull out fluid, and then you measure what we call bilirubin, which is yellowness. And so we were the first ones in South Dakota to start fetal monitoring. And the first fetal monitor I held on my hand and just sat by the patient's side. And when it was beating regularly, we were fine, or the nurses eventually got involved in it. Then we had mammography, where you take x-rays of a woman's breast looking for early cancers. And so a group up in Winnipeg was doing what they called intrauterine transfusions. I think she was from Mitchell. I tried to send her up there, and she wouldn't go, and I tried to send her, two places, and she says, no, she says, either you're going to do it or it's not going to be done at all. So I found at the Fitzgibbon Hospital, I think it was Air Force in Denver, and I talked to a guy out there, and he said, well, you come on out. So I went out and watched them do a couple, and then went back and tried. It was just read, hear, and learn. Dr. Keith Hansen is our in vitro specialist right now. And we were at a medical meeting, it's been a while now, and he said, Milt, he says, I've got somebody here I want you to meet. And he brought over one of his lab techs. And she says, I'm one of your intrauterine transfusion babies. What a story that was, because normally under normal circumstances, she never would have been delivered. I mean, she would never have been delivered alive. You know, when you ask about why do you want to be a doctor, I don't know that. I guess I just found it. But I know that one of the things that's been part of me is that I wanted to try and leave this place a better place than when I came. I don't know whether I have.